We are in Sinje, a community with hundreds of inhabitants in Bon County, north-central Liberia. This is where Martha lives, a woman full of life who has a small business to provide for her family.
I can fit plenty bread, corn bread, short bread, rice bread, color, donut, cake, cookie, all that one I can fix it. So when the bread up buy, I get my Lynn. When they buy from me, I take the money I buy, I be giving it to people to feed my block. So I ask people to go bathe my horse.
It's my woman. I met her. She was to our home. I asked her for love. She told me that I agree, but my first husband, he and myself were there. I got saved from him. But he is not with me now. No his location, I don't know where he's going. So I told her that I want you. She told me that I'm sick. I said, no problem. Since you told me that you're sick, maybe you agree with my love. I myself I will love you. I sent her to Phoebe Hospital. She went there to treatment. The people went. She went on an operation, but the wife was not cured. So we did hear it was over radio that say people in Monrovia helping people. That's why I told her to go there. So since she went, she got well, but she has not did well totally.
Martha had obstetric fistula, which is an abnormal communication between the vagina and the bladder and/or the rectum due to injury of the maternal tissues during prolonged obstructed labor. This condition affects millions of women around the world.
I was small. I get a sickness. So when Angie then care me, we have Sando, I get well.
Liberia is a country of about 3.5 million inhabitants. Over half of this population are women, hundreds among whom have been living with fistula for years. Here, there are 994 maternal deaths for every 100,000 births. Such a maternal health shortfall can hinder national growth and development, to which women contribute significantly through their daily economic activities. At the C.H. Rainey Hospital in Kaketa, about 75 kilometers from Monrovia, the capital, many women are waiting fistula repair surgery.
I was pregnant, they may run away from me because the child already finished dying. After I was period for 1 year, they may run away from me. I was not having nobody to help me. I leave washing clothes for my friend on there. Yeah, what really like doing the way in GFK. Because when I wash the clothes, my friend will give me late food to eat. Because all my family, they reject me.
Since we discovered this, since we noticed that fistula is a problem, the best way to solve this problem is for us as Liberians to put ourselves to work, not to rely on foreign troops or foreign team to come and do the work for us. Fistula is so great in the country to the extent that in 2006, a survey conducted revealed that 351 women were operated because of fistula. And since we launched the fistula project, as we speak, we have operated close to 800 women. That shows to you that the situation is very grave in this country.
This obstetric condition almost became a national disaster worsened by the civil war in the 90s. However, the government, with its partners such as the United Nations Population Fund, with support from Zonta International, are strongly committed to tackling the condition. Today, Liberian health authorities insist specifically on a holistic approach to end fistula by focusing on 3 steps, which are prevention, medical treatment, but also socio-economic rehabilitation and reintegration.
We've, as a nation, we started the fistula program a few years ago, and we've laid serious emphasis on it so that we can actually address and manage the cases that already exist, and to be able to prevent the occurrence of new cases.
According to the World Health Organization, obstetric fistula can be avoided when certain conditions are met. such as delay first pregnancies, stop harmful traditional practices, and allow access to timely obstetric care.
In terms of what is available, it depends on the hospital and the personnel. So not everywhere in this country you have staff physicians able to perform fistula surgery.
Information and public awareness sessions or drama, as here in Kakata in mid-September 2011, are means put in place as part of the National Prevention Campaign. Obstetric fistula prevention and treatment contribute to improving maternal health, the 5th Millennium Development Goal to be achieved by 2015.
Are a few of the questions that have increasingly alarmed us as a nation. Taking into consideration our culture, tradition, and our social focus. For the purpose of this important endeavor, we must therefore set aside those beliefs many of us consider sacred to our traditional well-being and look at fistula reunification on health cases. If we allow fistula to spread with no check, it will be a serious problem for us Liberians.
The ultimate goal of the various stakeholders in this program is to give back to the Liberian woman all her dignity, trampled by social exclusion and stigmatization due to fistula. Liberia's fistula program stands out for not only being included in the National Reproductive Health Policy, but also because of its Rehabilitation and Reintegration Center. Since its inception in 2007, the center prepares cured women who have suffered strong discrimination before their treatment to return to their respective home communities. The center, which was in Monrovia, has recently been moved to Phoebetown, Bone County, to make it more accessible to rural women who are mostly affected by the condition. Tens of women have so far been at the center to learn various trades such as tailoring, beauty care and pastry, among others, in a bid to make their socio-economic rehabilitation easier. This is the case of fistula survivor Sando Moore.
When I was to my people near to the village, I was suffering from pee and poo saying there. But now I feel fine when I came the day my way I already now among my friends I feeling fine. So I want from here, after learning my training, when I go back, I want to be educating my friends concerning about the things fistula business. I want to go to school.
They want to build you in a way that you become more sustainable. You can help yourself. You will be able to make a better family. But those who even rejected you before will be coming to you. They say rejected stone become what? The cornerstone. Tomorrow we want you to be the cornerstone of this society.
Yes, sir.
I think the success that you have seen in the field is that we have been able to restore hope for women who otherwise were completely hopeless. You have seen that a number of women who have been repaired have been able to be back in their communities, back with their families, back with their husbands, some of them, and even to be able to have children later on.
With the mobilization of different stakeholders and the strengthening of the medical infrastructure in Kakata, Phoebe, Banga, or Bomi, a new day is dawning for women with the fistula condition in Liberia.
Every 2 years, we aim to get around about $4 million US from our membership. And so these women who give, our members, Zontians, you know, they're for the grace of God, go them. And so for them, we're helping other women who aren't as fortunate as themselves in places like Liberia. We're also in Rwanda, and we're also in Central America.